You're listening to Maximum Medicine Radio with host Doc Martin. Stay tuned in or call in. You won't want to miss what's happening next. How do you step into your maximum potential? How do you connect your spiritual drive with your physical path? Stick around as Doc Martin takes listeners on a journey through the seen and unseen, the accepted and the unbelievable. Get ready to meet the maximum you the world needs on Maximum Medicine Radio with Doc Martin now. Hi, everybody. I'm Doc Martin on Maximum Medicine. And you're going to love my guest today, Dr. Mark Shrime. And he is a head and neck surgeon. He is an author. He's a thinker, a solver, and a ninja warrior. But I want to tell you how I landed on asking him on the show, because what he's done is the stuff that this show is all about. So as it's not the best technical savvy boomer, I learned a couple years ago how to scroll through Instagram. So I go through threads. I'm not on X anymore. You don't even have to ask me the politics of that. And I go through Instagram and I'll see something that I think, here is somebody who has stepped out of the ordinary path and momentum life is going into something bigger. And we'll talk about that all this time. And just for those of you who don't know, and Mark will correct me, being a surgeon is a big deal. Being chosen as a surgeon is a big deal. Being chosen as a surgeon in one of the best top training programs ever makes you even bigger. So you're already at the cream of the crop. Out of surgery, neurosurgery, and ENT, otolaryngology, is a big deal. So just from a physician standpoint, you're already seeing somebody who has mastered things that very few of us can do. Well, Mark then also is a head and neck surgeon. So all of this academic experience and talent and genius, and he should be the chief of a department somewhere. That road doesn't always fill us up. And this is where my show is all about. It's about how spirit directs us. And Mark will use different words, I'm sure. But I want him to tell you, because he jumped off the fast-moving train for glory and academic prowess and titles and ended up somewhere else in a life filled with purpose and presence. So, Dr. Mark Shrime, thank you so much for being here.
Thanks, Doc Martin. It's great to be here. Yeah, I appreciate the introduction. Only one correction, which is that I'm not a neurosurgeon.
You're otolaryngologist.
Correct. Yeah. Otolaryngology and head and neck surgery. So as I like to say it, I stop right at the brain. Like if I get into the brain, it's a real problem. But yeah, it's been a convoluted path through medical training and practice and academics, and I might sort of go a little bit lateral to what you were saying, which is that I did, in my book, I call it the moving sidewalk. I like the analogy or the metaphor that you have of the fast moving train. I did jump off this moving sidewalk of academic medicine in pursuit of that, but not before doing the things. So it was a bit of a like, okay, so and I'm sure we'll dig into this. I've made it to the thing that people were telling me I was supposed to get to. And boy, is it not what I want to be doing. Boy, does it not light me up. Boy, does it not fulfill me. It's not where my passion is. So yeah, I mean, I'm sure we can talk more about that, but it really was, it really has been a career that has been unpredictable, but in the best of ways.
Mm-hmm. So looking back from where you are now, to what prompted you to get off the moving sidewalk?
Yeah. Well, I'll start a little bit far back, if you don't mind. I did not want to be a doctor at all. being a doctor was not my calling. It was not my where I thought my life was going to go. I wanted to be a linguist. That's
I wanted to be a veterinarian.
yeah. So see, there you go. Like I
Mhm.
dreamed I would read books about linguists, and like those were my heroes growing up. But I am the firstborn son of an immigrant family. I was born in Lebanon. My parents came from Lebanon. We moved when I was very young. We moved when I was 2. But firstborn son of an immigrant family, as many immigrants will know, we have 3
High
options.
expectations.
Exactly. Doctor, lawyer, or failure.
Mhm.
So I went to medicine to some degree because of that that drive, that push, that filial obligation. Um, so I won't belabor I mean, we can if we want to, but I won't belabor the 15 years of training for, medicine and surgery while you hate what you're doing. It was painful. And what first prompted me to realize that there may be a different path than what I was on, the moving sidewalk that I was on, was after I'd finished my med school residency fellowship. I took a year off and spent 6 months of that year just traveling, just doing the like find yourself sort of thing. And then I spent 6 months, the second 6 months of that year, working as a surgeon on a hospital ship docked off the coast of Liberia. And there I met people, including a man who's become my mentor, who had gotten off the moving sidewalk and who were doing totally different things with their lives. Um, and that was the first time that I was like, oh gosh, I have been training for something that I never wanted to do, I thought, but now all of a sudden here's this whole other path open to me where I can use the skills that have been indoctrinated into me, for lack of a better word, over the last 15 years in a way that serves my passion. Now, that was 2008. I did not shut down my US practice till 2018. So it was still another 10 years before really getting off the moving sidewalk. But that was the first nudge.
So don't leave 2008 yet. I want
Okay.
the listeners to hear you're on a hospital ship off the coast of an underdeveloped country
Right.
where there are people who have no physicians, much less a
Right.
renowned specialized head and neck surgeon. So now you have, tell me the types of patients that are now on your docket for the morning.
Yeah. Here is the really, no, I didn't, in 2008, I wasn't putting this stuff together. This is what, 17 years of retrospect. And
Mhm.
I've been doing this. I've been going back to this hospital ship for 17 years. So I've continued to do this sort of work. Um, the patients were no different, to a large degree, no different from the patients that I was seeing in my practice, in my fellowship, and then later on my practice when I was an attending surgeon. The tumors were the same. The pathology, like under the skin, the pathology was exactly the same. The difference was what you said. So the tumors that I'd see were huge, like literally 16 pounds. They were massive tumors off of people, hanging off of people's heads. Um, and it's really tempting when you hear things like that, when you see pictures like that, to think, oh, there's something different about African tumors. There's something different about African patients. There's something different about whatever, the food in Liberia. The single difference is a lack of access.
Mhm.
So if you and I noticed a lump on our jaw, we would be in the doctor's chair, within 2 weeks, within a month.
At the size of a grape or a
Correct.
pea,
Correct. Yes. I mean, it's very
not the size of a cantaloupe.
not the size of their head. Yeah. It's very common when I was
Mhm.
practicing in the US, the patients that I would see would notice the lump on their neck as they were shaving. They'd be like, oh, look, there's something there. Tiny, size of as you're saying, like size of a pea. Whereas these patients notice it also at the size of a pea, but they have nobody to take it out. So it just grows for 25 years. Um, so the interesting thing to me, one of the most interesting things about the direction that my own career has taken is that I'm still a surgeon, right? I mean, we can talk about the other stuff that I do, but part of it
Mhm.
is still surgery. I still cut and sew, but I cut and sew now in service of a very different why than I was doing before.
So underneath that, if we can unpack that, and might use words that may have context for you, but maybe you wouldn't use. But underneath that, and I was just talking about this in the show I did, I recorded recently with an animal and human chiropractor. Underneath that is a sense of purpose that fills you up in a way that you think, and I'll use God, you can call spirit, you can say your higher self. You have these God-given talents that all of a sudden you realize that despite, I mean, I ended up in medicine literally by happenstance.
Hmm.
I wanted to be a veterinarian. But when I finally gathered all my thoughts and realized I have these talents, I have these abilities, and I'm fulfilled at the end of the day because I do my best to make a difference. That sense of being filled up and being and feeling that purpose, is that what keeps you going in this arena as opposed to how you used to do it?
Absolutely. That's 100% it. It's, it's easy to, how do I want to say this? You can look at people who do the work that I do, the global health, global surgery work, and you can, and I really hope to God you don't. You can say, "Oh wow, what great work you're doing! So sacrificial, et cetera, et cetera." I think that's wrong. I mean, on some level, sure. Like I don't have the practice that I'm going to be able to buy a Jaguar with, right? But fundamentally, I do this because I get significant fulfillment out of it. Um, I, I, I don't. I think we all can try to be altruistic, but I don't think anyone is fundamentally altruistic. We all do have some measure of self-interest, and for me, the self-interest is that sense of why, that sense of fulfillment, that sense of I feel like for the whatever 70, 80 years I have on this earth, I get to use the talents that I've developed in service of the thing that drives me, the thing that sets my soul on fire.
Mm-hmm. And you've written a book, Solving for Why, and you're also trained in decision making,
Yes.
which is pretty analytical. The solving for why seems like it has a more mystical or spiritual context to it. But tell us what you tell people or teach people about that concept of solving for their why.
Yeah. So as my career has evolved, really only in the last few years, I've really started moving into in this sort of second half of my career, moving into working with primarily healthcare providers of all sorts, from doctors, nurses, vets, dentists, you name it, who have who find themselves burnt out by being stuck in a system that doesn't fit with their why. They find themselves stuck. They find themselves at a place where uh, I went into medicine for this reason, but medicine as it's practiced in the US right now is not that. It is financially driven, it is RVU driven, it is all those sorts of things. Um, I can't do this for the next 20 years of my life. Like that's there's a lot of that happening in the
Mhm.
medical profession, and I'm going to use medical here very broadly. When I say in medicine, I also mean in nursing. I also mean in sort of in a One Health approach. Just to sort of say that right now, I don't just mean doctors. Anyway, there's a lot of that burnout in and that stagnation, that stuckness, that like, gosh, this does not fit what I want to do. As you said, I have my PhD is in the science of decision making. The book Solving for Why does talk a lot about just sort of articulating what your why is. And in the folks that I work with, the clients that I have going through this often mid career transition of medicine's been good to me, but also I'm tired of it. Uh, we combine both. We combine the introspective, uh, to use the words that you've been using, kind of spirit focused um, excavation. What is it that what are your values right now? If you're honest with yourself, what are they? And then we bring in all the tools, all the analytical tools from the world of decision science to help actually make decisions around that. One of the things that I find with a lot of folks in medicine is that we we have three main barriers. One, we have this sense that I've been doing medicine for 20 years. I have no other marketable skills besides being a doctor, being a nurse, being a vet. So I have no other marketable skills besides medicine. I have no idea what's even out there. Like, how do I change? And then the third,
We're so one track, and
totally, yeah.
training to get there is so overwhelming. You didn't even have time to have a life.
And it's even more than that. I agree with that 100%. You're exactly right. And also, I don't know if this has changed. I'm 20 something years out of medical school, but when I was doing my training, even the idea that somebody would do medical training and then not be a doctor was
Oh no,
frowned
the
on.
shame. Oh
The
yeah,
shame, exactly.
there. Yeah,
Yeah. So it is that we
you
spend all
would
of our
be a
time
mega failure.
100%. Yep, 100%. So we don't think we have any other skills besides clinical. We don't know what else is out there for us, and we don't even know how to approach this decision. So that's where the decision science stuff comes in. Is we actually, we look into ways to approach this decision that matches with your own why.
So, what types of values have you found people hold as the reasons that they get a fire lit under them, the reason that they're happy to get up in the morning and go do this? What are some of the, have you found in your,
Yeah. There's they're very broad, and I take a really agnostic approach to this. If somebody comes and tells me the value that really drives me is getting really rich, I mean, I'm not going to tell you that's wrong. I might have my own opinions about people's values, but that I don't live in their lives. So that said, people in the clinical professions have tended to go into the clinical professions because they wanted to either help people, make an impact, make change. Some version of that really does drive them. Other things that drive them are more sort of more proximal, closer, provide the best life for their family, spend time with their kids. Uh, and the interesting thing that a lot of my clients have to struggle with is that the values that drew you into clinical work may no longer be the values that you have in your mid 40s or early 50s. They may have changed. And there's great science about the fact that they do actually change. Some of them will stay consistent, but not all of them will. So there's a bit of a letting go of what we thought we should, or what we used to have, and also letting go of what we think we should have. The reason I take a very agnostic approach to this is because there is judgment that people put on other people's values. And if we're only working with what we think we should be doing, we're never actually going to be as fulfilled as if we were working with what we should be doing, what we want to be doing.
Mhm. When you help people see when they to get the matchup between how they act in the world and how they want to impact the world, what what changes in them when they hit that spot where they are able to recalibrate to a better matchup instead of staying in the mismatch? Tell me about the downstream thrill you get when you see people
Yeah.
reaching that.
I'm going to address this in two different ways. The first way is that, um, you know, I come from, I grew up religious. I grew up in both the Catholic Church and then in the Evangelical Christian Church, and both of those churches. And I realize this isn't a religion podcast, but this is important for me in the way that I approach life. Both of those start with kind of a statement of faith, and then you gotta like shoehorn the reality of the world into that statement of faith. Um, Whereas often in the decision science world, we call this revealed preferences. But really, what you often see is that the way people act actually reveals what their deep down values are. If we're, which is going to get to the second thing, if I'm trying to conform my actions to a value set that I don't believe in, then it's going to leak out somehow. That tension is going to leak out somehow. And this, which gets me to the second way I wanted to approach this question. Part of what we face, especially as clinicians, is that we have been trained to ignore those warning signs and to elevate basically path over purpose. I've been on this path for 15 years as a doctor. It doesn't fit me anymore, but look, I'm on this path. And so I'm just going to try to shoehorn my purpose into that path. Whereas what we really need to be doing is flipping those, putting purpose first, figuring out what the heck you want to do, what the heck is it that you actually value, and then creating the path to achieve that. Because the harmony that you see in people, the joy that the contentment that you see in people when they flip that, when they're starting to now actually live, their path is now in line with their purpose as opposed to the other way around. It's night and day. Like you don't even realize what you're missing until you've started to experience that, if that makes any sense.
That same discordance, I sense in people in my internal medicine practice all the time. And it's a discordance a little bit on a different level, but the concept's the same. It's a discordance of how they're presenting and what's really going on underneath. And there's misery and suffering in that discordance. And as you said, a lot of this, I've got to stay on this path. I've trained, we all have been indoctrinated, I think, culturally, through our families, through society, of following a path governed by the drill sergeant.
Yep.
And we are whipped, and we have our own internal, we are our worst critic. And what's happened in our society, and what I think a lot of what's going on in the new ways of thinking and the younger people, they want to come from a place of pleasure, contentment, peace, and not following the rules. It's interesting. I'll just digress and share this corollary. So many of, I'm a boomer, I'll admit it, so many of my generation will be working with younger people, and our work ethic is complete opposite ends of the spectrum. But I was brought up to be driven and a workaholic and push, push, push. And I had to stop myself a couple of years and think, I think it's important that these people need to be coming because the job is here and this and this. And they're like, why am I fighting for this job? They're not company, our grandparents were company men and they owed their lives to the company store, so to speak. And all of a sudden I'm saying, well, maybe they're not wrong. And I think in helping them see, I do it when they're dealing with an illness and I sense the underlying emotional suffering, but helping you find that it's not wrong to want to have a heart-driven life. It is not wrong to want to have joy from what you do in the world. It is not wrong to create and put forth your talents and get rewarded by being filled up with a sense of excitement and satisfaction. And I don't think we're teaching our children that that is a good goal. That is a good way to be. Can you talk more about that?
Oh man, so many things that you just said. I want to comment on. I 100% agree with everything that you just said. Let me talk broadly, and then I actually want to bring it back to clinical work. Broadly, I think that's true. The interesting thing is, so I'm Gen X, and even in the 1970s when I was born, there was already research by a gentleman named Hall, and I cannot remember his first name, but Hall. But Hall started doing some research on what he ended up calling the protean career. and distinguishing, now again, I'm drawing a blank on what the opposite of the protean career is, but I can describe, I'm drawing a blank on what he called it, but what he described it as is exactly what you described. It's the company man. It's that advancement within IBM is the goal of your career. It's loyalty to IBM is one of the driving factors in your career decisions. It is what my parents' generation, and also kind of what my generation to some degree lived by. And his research already, again, in the 1970s, was about careers that he called that were more protean, that were more individual driven, that the goal of the career was not necessarily advancement within the company or advancement along the academic or career path, but it was personal fulfillment. It was creating a career that was in line with exactly all the things that you were saying. What drives you? What is your why? The second thing I wanted to say is to bring it back to medicine or to clinical work. The zeitgeist, most of the conversation has turned away from the loyalty to IBM world. We recognize that is no longer the case in most of the world, except in medicine. We still assume that, and you said this in the introduction to me, we still assume that the pinnacle of the career of a surgeon is a successful private practice that they've been in for 30 years, or is an academic practice, or is chairperson of a department, or is all of those sorts of things. And we're still in the very non-protean model for our careers as clinicians. And just like it did for the boomer generation, for my parents' generation, I don't think that actually leads to satisfaction, especially because there was at least in theory, a bidirectional loyalty, company to employee, employee to company. That direction of company to employee, that loyalty is gone. Way gone. And yet we still somehow feel like, well, because this is my career path. I must stay at whatever. I must be at Harvard and stay at Harvard for the rest of my life and advance in that academic track.
I felt, and then you're helping me verbalize this because I recognize what I felt, and I've never talked about it as such. I trained at Hopkins. So, of course, that's you've punched the golden ticket. And I decided to go to residency at a community program about 90 miles up the road, maybe 60 miles up the road. And and as I look back, I felt a huge amount of shame of having climbed the ladder. I was a PhD physiologist, taught at medical school at Emory University, was an assistant professor of medicine. Then I go to medical school at Hopkins, and I'm climbing the ladder to the golden throne. And Hopkins, I'm sorry if I'm talking about you behind your back, but I was miserable. I was the oldest person in my class. I knew a lot. I had been a professor. I had taught medical school. So in rounds, if I offered something, and even if I said something that the attending or the chief resident didn't agree with, oh, that was a no-no. So I got, scolded and dismissed and wished that I had shut up. Well, I wasn't going to shut up. I'd never shut up. That one-upsmanship environment it was torture. It was torture. Everybody was scared. Everybody had the hierarchy. You had to follow the hierarchy. You were treated like dirt. You were literally physically suffering. You didn't get any sleep. It was horrible. And I said, I'm not doing it. And I went to a community program in York, Pennsylvania, so north of Baltimore, where the majority of the faculty were trained at Hopkins and University of Maryland. So, everybody thinks, oh, you're going there. They disdain, sneer at the quality. It's got to be a subpar. It was superb. And the collegiality was superb. And the individual attention you got and the encouragement you got. And it was life changing. And but it came as I look back on it with this idea that I had squandered my hardly won, everybody would be fighting me for this chance to reach the golden throne, and I'm throwing it away. And here I am in rural Pennsylvania in a county of 13,000 people in a clinic, which is the farthest thing from Hopkins. But to get off of that moving sidewalk and to get out of those things that had driven you to climb to begin with, ambition, excitement to learn, to be surrounded by some of the smartest people in the world, and the ideas flowing, and you would think they'd be sharing and that there'd be collegiality and everybody would be stimulated. And it was literally like you were at boot camp. And I said, this is horrible. But it comes with shame. It takes a lot of courage. And I guess I should pat myself on the back for the courage I had back then to step off of that.
Yeah,
But
it takes, go ahead, sorry.
huge. No, please go ahead.
No, I was gonna, it takes a lot of courage. Clinicians, we tend to be relatively risk averse. And we do, I mean, for good reason, right? Like we don't want to take significant risks with our patients that have big potential downsides. But we tend to be risk averse. And so humans in general have a status quo bias that we would rather, that nothing changes. And I think physicians or clinicians in general are potentially more bound by the status quo bias. So it does take courage to step into something that's completely unknown, that may be a loss, and yet that may also be a real gain for you.
And you give up that need to hold an image.
Yeah. Yeah.
Well, I think I figured out, even if I didn't intellectually understand it, I could speak about it back then, but that's not the image I want. Every one of the residents was flippin' miserable. Their relationships suffered, their health suffered. They were not nice people anymore. All of that open heart sharing and generosity was squelched out of them, I thought. And maybe being older, going to medical school, maybe in retrospect, that was a really good thing, because I was like,
Yeah. But that also gets to, we can't dismiss the fact that you did give something up by doing that. You gave up the exchange of ideas that happens in big universities that literally does not happen in other places in the same way. Like it just doesn't. You gave that up, but that's to bring it back to the top half of this podcast. That's where the why comes in. It is a good thing to be in a position where there is an exchange of ideas. It is also a good thing to be in a position where everyone's nice to each other. It would be an ideal thing to find everything all at once, but it's very rare to find everything all at once. So if you're driven by, if you're acting based on something that you are not driven by, then that's where the mismatch is going to be, right? If you're not driven by that exchange of ideas, even if that's not what fundamentally drives you, then
to the exclusion of the other.
Correct. Again, I mean, it'd be great to find someplace that had everything. I haven't found it yet. I'm still hoping. But that's why you've got to start with what is it? What are the three things that I want to solve for in my career? And by solve for, I mean, what are the three things that I want to create my career decisions around? Is it the exchange of cutting edge ideas and the name? Then you'll stay at Hopkins, at Harvard, or wherever, and you'll kind of be more okay with the downside that people are kind of mean to each other. Whereas if it's this other sense of where one of the things that really drives you as a collective, if somebody's really driven by a really strongly collegial work environment, um, they may down regulate the importance of that free exchange of super cool cutting edge ideas, because that's not what drives them, and they should make a different decision. But again, our society is driven by image, so it's harder to make that decision because it does feel like you're quitting, you're giving up, whatever. I have a very morbid thing that I'm going to say.
Okay,
um,
I'm ready.
who was the president of Hopkins 75 years ago?
I have no idea.
Exactly. That's exactly the point. And it's the morbid thing was me, for me, it was
Was
realizing that,
Flexner? No, he was probably 100 years ago.
well, I mean, my point really is that
I'm
you
just
don't
like, who did?
know. Yeah, who knows? 75 years from now, the likelihood is nobody's going to remember your name. Nobody's going to remember my name. My
I have
father,
I
go ahead.
have this saying I use in my practice. And I'm not a practicing Christian. I was brought up Catholic, but I'm probably more of an animist. Um, but I'm always saying to the person when they say, well, I can't do that, or I'm not going to change this, or I always say, why? Or they
Right,
say, well, I have to do this. And I'll say, who says?
right.
Who
Yep,
made that? Who made that rule?
yep,
Who
exactly.
made that rule by which you're living? And then I will say, let me just ask you this. So you die and you go to the pearly gates, and St. Peter's there, and he says to you, okay, Diana, why should I let you in? Are you going to say, well, I worked at the company for 35 years and I got a gold watch and I made sure I brought home a paycheck all the time for my wife, or whatever. I use Diana, so that wouldn't be an accurate thing. But, you know, what is he going to let you in? With what characteristics do you win the ticket to heaven? In other words, showing to people what is it that is long lasting, and I believe in a soul. What is long lasting in your soul that matters? What is really going to matter when you're on your deathbed, surrounded by your children and your grandchildren? What is it that you want to say on your
Yep,
tombstone?
yep, yep,
What is
yep.
it that you want to claim your value in this time on earth?
Yeah.
And
Yeah.
Hopkins wasn't it, you know?
It's the third part of the program that I do with providers who are in that stuckness. It's a 4-part program. Part number 1, we talked about finding out your why. Part number 2, we bring in the decision science stuff. Part number 3, we take a really big pause before going forward and do exactly what you just said. You're now 95. What does your obituary read? And how do the decisions that you make today at 45 bring you closer to that obituary? It's super morbid. It's a hard exercise to do if you really start thinking about it. Um, but I think it's really important because we have however many years on Earth, and it's the only thing that we're certain of is that we have however many years we have on Earth. So what is it that you want to spend that time doing? I will say, so when I started to scale back my practice, so between um, 2011 when I started to do my PhD and 2018 when I told you I closed my US practice, I was starting to scale it back and really wanted to go down this global health route. And my partner, my work partner at the time, the guy that I operated with, uh, I, we're still very good friends. I literally talked to him last month, but we didn't see eye to eye necessarily on this. And I will admit that I initially had a bit of judgment of, well, why not? I'm doing the good thing. I'm going to operate in Liberia. But then I realized that what drives him is what I was saying to you earlier. What drove him back then was providing the best life for his family, and being the best surgeon that he could be for the patients that he had. Um, and it really, really kind of drove home that I don't get to tell you Doc Martin what your obituary should read, and you don't get to tell me what my obituary should read, and I don't get to tell him what his obituary should read. He has to tell me what he wants his obituary to read, and that's really what's important for us creating a life in line with our why.
I was thinking about this, writing your obituary and thinking about a shamanic practice of recapitulation. And that idea of being faced with being stripped down to your bare essence and looking over your life and deciding what were the good parts, what the parts you don't want to repeat, and literally deciding how to go forward. And I think that's the other thing is as we are growing up and we haven't really been given permission to follow joy and pleasure and contentment. The other thing is we haven't really been shown that you get to create from this moment forward.
Right.
And it's okay
Right.
if the other stuff doesn't continue, it doesn't mean that it hasn't changed you inside, that you haven't been wiser. That just because you leave it doesn't mean that it wasn't valuable in making who you are from this moment forward.
100%. Yeah. I mean, I did my PhD also later in life. So I started my PhD at 37, and I was a different PhD student because because I'd practiced, because I'd already done the global health stuff a bit. So I came into my PhD very different than my other colleagues. Again, not better or worse. I had a different set of experiences that I was coming into with. The other thing that I also find with my clients is it's too late, right? It's too late. I've devoted 20 years to this. So it's just too late for me to, old dog, new tricks, et cetera, et cetera. It's a cliche saying, but the best time to plant a tree was 20 years ago, but the second best time to plant a tree is today. And so, yeah, it's not too late. Maybe you regret not having planted it 20 years ago, but you can do something about it today.
That's the other thing I like to work, well, mostly probably in my personal life with the people who understand my spiritual bent and the idea of, regardless of my age, how can I be the most vital and the most vibrant? And for me, that's learning new things. It's experiencing new things. It's having the courage to change up. Which brings me to ask you something and I want you to talk about. We have about maybe 8 minutes left. Something that took a lot of presence and commitment. You trained in American Ninja Warrior.
I did. Yes.
That's a big deal. I mean, physically, mentally, being totally in flow. Tell us how that is. Tell us what do you do when you're American Ninja Warrior?
Yeah. So it still is a TV show. It started as a TV show, actually started as a TV show in Japan, not called American Ninja Warrior. And then it was ported over to the US and renamed. It still is a show, although it's really become a sport of its own right. The show being secondary. But the short story of how I got into it was like all good decisions, that decision happened at 1 o'clock in the morning when I was watching YouTube videos of old episodes of Ninja Warrior. I had been a rock climber for a few years at that point and was like, oh, I'll do this. This should be fine. No worries. So I applied in a fit of hubris and then got accepted onto the show, never having actually trained for it. When I got the call that they wanted me to compete,
That actually was kind of hubris.
Oh, 100% was hubris. It was 100% hubris. Absolutely. Yeah, yeah. And so they give me the call that they want me to compete. They tell you you're going to compete about 3 weeks before they actually film. So 3 weeks before I'm going to go to Philadelphia to film for this, I'm like, well, crap, I need to actually train for this. So I Google, Ninja Warrior gyms. I was living in Boston at the time, Ninja Warrior gyms in Boston. And I found one and I went there. And again, in a second fit of hubris, I was like, look, I've been a rock climber for however many years at this point. I have decent upper body strength. Like I should be fine. And I got to the Ninja Warrior gym and fell on everything. Like could not complete a single obstacle. But anyway, went 3 weeks later, I trained like crazy for 3 weeks, went 3 weeks later onto the show, did all right, did decent for a first timer, was very proud of it. And an obsession was born in that became my identity. I literally just wrote a blog post about this yesterday. That became my identity. Yes, I was a surgeon. Yes, I was in global health. Yes, I was an academic, but really, like, where I came most alive was at the Ninja Gym. And one of the reasons for that is what you were saying. It's a physically very difficult sport. I did not grow up athletic at all. So part of it was just proving to this nerdy kid that he can do the thing that as a kid he was never able to do. So there was a little bit of that, but it is an intensely physical sport, but an even more mental sport. Standing 16 feet above a platform and jumping 10 feet in front of you to try to catch a bar is terrifying. And more than anything else, what Ninja taught me was that you got to do it anyway. I remember I was training with a friend of mine one day, and we were setting up. One of the skills in Ninja is agility and balance. We were setting up a balance obstacle. The whole point of these obstacles is to tip you over and make you fall. And we finished setting it up, and he looked at me and he's like, "This is stupid, isn't it?" I was like, "Yeah, it's stupid." He's like, "Let's do it." And that mentality of I could get hurt. And in fact,
Well, that's kind of like a Jackass movie.
I mean, yes, although not as
Foolish.
foolish. Yeah.
Well, I'll tell you what I like about it as an outsider looking in. And that kind of plays up to the things that I talk about on my show. When you are in total communication, connection, concordance of your mental and your physical, and
Absolutely. Yep.
you are, I'm going to just use words as they're coming in my imagery, you are an arrow just shot out of a taut bow, sailing without error to the target. You are in total flow of being human, in total and complete. I find that exhilarating. I find that commendable. I find that exciting, even when it's foolish and full of
Yep.
hubris.
Yep.
You are in a zone that is incredible.
Yeah.
It
Yeah.
just, I can imagine that being, no wonder it's, if it was an obsession, I can see why.
Yeah. And it really is, because
Mhm.
it forces you into that place. You have to take risks to do that. You don't get into flow without taking risks. You got to take risks to do it. But yeah, absolutely.
So we have about 3 minutes left, and then we'll be closing up. How, what would you say to people, whether they are in a work burnout or a life burnout, or in everything you've learned, surgeon, global traveler, ninja warrior, what ideas or thoughts or encouragement might you tell people? Life lessons, so to speak.
I'll go back to the thing that I said about halfway through this podcast, which is I think the first thing that you've got to do is you've got to examine which direction is your hierarchy. What are you putting above the other? Are you putting the path that you are currently on as the most important thing and then trying real hard to convince yourself that your purpose is in that path? Or are you putting that path, that purpose first, and then designing forward for that purpose, designing your path for that purpose? And again, as I said, best time to have made that decision was 20 years ago. Second best time to make that decision is today.
And I'm going to tack on my little soapbox. If you can have, and I'll use the word spirit loosely, your higher self, your your heart's wish, your soul, whatever, God, if you have spirit driven and you're concordant in your beliefs, your heart and your actions, any path you take, you are creating from your essence, and the world is a better place. And as you say, Mark, everybody gets to write it the way they want to.
Yeah. Yeah.
But if you are zinging and humming on that chord, CHORD, of your essence, when you're finely tuned and everything is aligned, you're unstoppable, and the world around you changes. And I believe it changes for the better.
I agree. I agree.
I loved having you come on board. I loved meeting you. I'm so glad I found you on social media. Dr. Mark Shrime, thank you so much. And he does have a website. It's markshrime.com.
It is. Yep.
And he'll talk about how he works with people to find out how you can put your purpose before your path. Thank you so much for being with us today.
Thanks so much for having me. It was great.
You've been listening to Maximum Medicine Radio with Doc Martin. Tune in next time while the doc talks health, spirituality, and the impact your beliefs have on every part of who you are, body and soul. Doc Martin unpacks the challenges we face as human beings and teaches callers to open the door between the scientific and the mystical. To learn more about Doc Martin and Maximum Medicine, visit www.sharonmartinmd.com.